Hi, my name is Jacob Goldsmith, and my research project is investigating the efficacy of H&B supplementation to attenuate the loss of skeletal muscle mass and function in sarcopenic individuals. Alright, so we'll start off today talking about what sarcopenia actually is. Coming from the Greek roots, sarx meaning flesh, and penia meaning loss, sarcopenia is quite literally the loss of flesh. So over on the right-hand side, we see a depiction of a cross-sectional area of thigh muscle. Up top is a young individual that has some subcutaneous fat surrounding the muscle, but inside the muscle it is mostly contractile dark tissue. However, as we age, we see a loss of skeletal muscle tissue and contractile tissue, accompanied by an infiltration of connective tissue within the muscle and a reduction in the cross-sectional area of the muscle. So this process happens through normal aging. So as people age, the skeletal muscle mass and function deteriorates. This process can start as early as 25 years to 30 years of age and can lead to loss of independence later in life and also an inability to perform the basic activities of daily living, such as carrying groceries from a car, getting out of bed in the morning, or walking a dog. This could also lead to increased risk for falls and fractures in the elderly. There's a myriad of contributing factors to sarcopenia, one being leading a sedentary lifestyle, another being malnutrition. Malnutrition could mean under intaking of energy, meaning calories, or specifically protein. Also, sarcopenia is associated with an age-related attenuation or lessening of the anabolic and anti-catabolic responsiveness. What we mean by the anabolic responsiveness is as we age, it becomes harder to stimulate muscle protein synthesis or the building of proteins within a muscle. And it also becomes more easy for protein breakdown to occur. So if muscle protein synthesis is lessened and muscle protein breakdown is increased, this will lead to a negative protein turnover and atrophy of muscle over time. Another contributing factor to sarcopenia is an increase in abnormal reactive oxygen species, or ROS. So this increase in reactive oxygen species can lead to oxidative stress and oxidative damage throughout the body. Also, with aging, we see a resistance to insulin, and namely, we see selective atrophy of myofibers. So when I say myofibers, there's atrophy of both type 1 and type 2 myofibers. However, type 2 fibers to a much greater degree, which are our explosive fibers. A few possible strategies have been laid out in the literature to combat the loss of muscle mass and function with sarcopenia. Namely, nutritional interventions, including increased caloric intake and also protein intake. So not only eating more total protein throughout the day, but focusing on timing. So through the research, it has been found that individuals can be more optimal with their protein timing because there seems to be a 3-hour refractory period after stimulating muscle protein synthesis. This means that if we intake adequate amounts of protein, about 3.5 grams of leucine, every 3 hours, we can maximally stimulate muscle protein synthesis several times per day, leading to increased muscle mass and lessened atrophy. Another strategy has been resistance training. There's overwhelming research to suggest that resistance training can help not only maintain muscle mass throughout aging, but also increase muscle mass and strength, even in atrophied elderly individuals. And when we get to supplementation, there's been several supplements associated with decreasing the loss of muscle mass and function. First of all, we have branched chain amino acids, or BCAAs, which consist of leucine, isoleucine, and valine. These branched chain amino acids have been pointed to as being the main driver of protein synthesis within a muscle. Leucine, the branched chain amino acid, is also the most important amino acid involved in this process. And creatine monohydrate supplementation has been shown to increase the energy within the muscle. So if we supplement with creatine monohydrate, we can actually increase the amount of energy we have stored in our bodies at any given time. HMB is a metabolite of the branched chain amino acid leucine, and that's what we'll be investigating today. Okay, so touch back on resistance training. To maintain muscle mass and strength over the course of our lifetime, resistance training becomes necessary. The loading of the axial skeleton can not only help to increase muscle mass and strength, but can also help to increase bone mineral density. We could also reverse the atrophy of type 2 myofibers this way. So if we recruit type 2 myofibers on a regular basis by lifting heavy weights at a high intensity, we can recruit these type 2 myofibers, which will lead to less disuse and lessened atrophy. Also, resistance training has shown to be safe and efficacious in elderly populations. So, along with the decrease in muscle mass and strength, there's a concomitant increase in fat mass. So, resistance training has been shown to decrease fat mass and maintain lean body mass over time, if not increase lean body mass. Resistance training has also been touted to suppress free radicals, which will lead to decreased oxidative stress over time. Which brings us to HMB, or beta-hydroxy beta-methylbutyrate. HMB is a metabolite of the branched-chain amino acid leucine, and it has many touted benefits in the literature. These benefits consist of decreased fat mass, increased lean body mass, increased overall strength, decreased muscle protein breakdown, and increased muscle protein synthesis, as well as an enhanced utilization of free fatty acids as an energy source, and also reduced exercise-induced myofiber damage. Another way reduced myofiber damage can be thought of is if we attenuate or lessen the amount of damage and soreness an individual has, we can speed recovery and increase the frequency in which they train, as well as the total volume that they can accumulate over time, which is the prime driver behind muscle hypertrophy and strength. So briefly, the metabolism of HMB. So when the branched-chain amino acid leucine is ingested, it is metabolized to alpha KIC in the liver. 95% of KIC is metabolized to isovaryl-CoA. However, 5% is metabolized to beta-hydroxy beta-methylbutyrate, or HMB. This HMB is involved in the ubiquitin proteasome system, also known as the catabolic system. So it may have an impact in reducing muscle protein breakdown over time. Again, this is a depiction of what leucine actually looks like on a molecular level, alpha KIC and HMB in the bottom right. Throughout the literature, there seems to be conflicting results, often dependent on population. In a normal, healthy population, there doesn't seem to be much effect with HMB supplementation. However, in inflammatory states of underconsumption of caloric intake, so catabolic states, and also overtrained states, such as the military, we've seen positive results with HMB attenuating strength and muscle mass losses over time. Specifically, we've seen studies with chronic obstructive pulmonary disease, cancer, cachexia, and HIV/AIDS. But what about an elderly population? What about a sarcopenic population? Cancer cachexia is similar to sarcopenia in that cachexia is a muscle wasting syndrome. They're not the same, but they have a lot of similarities. So the question we pose today, can HMB supplementation, in addition to a resistance training program, attenuate the deleterious effects on muscle mass and strength in sarcopenic individuals? Our hypothesis is that HMB supplementation, in addition to resistance training, will attenuate the loss of muscle mass and function associated with sarcopenia. So subjects. For this study, we will have 50 middle-aged, moderately resistance-trained sarcopenic individuals. For the inclusion criteria, we'll have them be able to perform a 1 repetition maximum back squat with a minimum poundage of their body weight. They must have at least 1 year of resistance training experience, and over the course of that year, they must have performed the back squat exercise at least 1 time per week on average. Also, subjects will be instructed to refrain from any additional outside exercise. Experiment approach. This study is designed to examine whether or not the addition of supplemental HMB free acid to a periodized resistance training program can have any additive positive effects on the attenuation of muscle mass and function loss associated with sarcopenia. So, we will have two groups for this study. They will perform the same resistance training protocol, but they will be randomly assigned in a double-blind fashion to one of two groups. The first being an experimental group that receives 6 grams of H&B every day, and a control group that receives a placebo. All subjects will report to the laboratory 3 days a week, Monday, Wednesday, Friday, for a total of 8 weeks, so 24 sessions total. Upon arrival to the laboratory on day 1, subjects will undergo anthropometric assessments and complete a 5-minute standardized dynamic warm-up. Following the dynamic warm-up, they will perform 1RM testing in accordance with USAPL specifications, using standardized 5-minute rest intervals. And then in weeks 1 through 8, weeks 1 and 8 will serve as pre and post testing respectively. Pre-testing 1RM and blood draws will be administered on day 1 of week 1, followed by light training 72 hours later. Weeks 2 through 7 will consist of a 6-week daily undulating periodization program. Daily undulating periodization simply means rotating or undulating through repetition ranges throughout the week. So 8 repetitions on Monday, 6 repetitions on Wednesday, and 4 repetitions on Friday, for example. The main outcome measures we'll look at are the 1RM back squat strength, as well as muscle thickness or hypertrophy. 1RM back squat strength will be measured by simply doing a 1RM pre and post, and muscle thickness will be examined looking at ultrasound pre and post, as well as body composition using skin fold calipers. The instruments used in this experiment will be a dietary and supplementation log in which individuals will keep track of their daily nutritional intake as well as their H&B supplementation or placebo supplementation. A health history questionnaire and a physical activity questionnaire will be completed along with the informed consent before the onset of the study. And as I mentioned before, we will utilize 1RM testing to measure maximal strength. So for the proposed statistical analyses, we'll use ANOVA models. So we use analysis of variance to detect differences between groups at multiple time points. The multiple time points will be before and after the training program. We will screen for normality and outliers, as well as when we find a significant F value, we will use a Tukey post hoc test to locate the significance. We report all data as means and standard deviations with significance set at p less than 0.05. For the software we will use is the statistical analysis software, along with the G-Power analysis software to analyze power. There are many limitations to the study. First being that subjects will be restricted to middle-aged sarcopenic individuals. So we will not be able to evaluate any age range outside of 30 to 50 years of age. And also we will not evaluate healthy subjects or individuals with other disorders rather than sarcopenia. The study will also utilize only male subjects, so we will not gather any data about gender differences. The final major limitation is that the study will only use moderately trained subjects. So we will not be able to gather any information about relatively untrained or sedentary individuals, as well as elite or highly trained individuals. Here are my references for this study, and I hope to conduct it shortly.